Hello, my name is Karina Granda. I am going to tell about Nadia intravenous iron in patient undergoing maintenance hemodialysis. Definition. Patients with chronic kidney disease frequently have alteration in iron metabolism. In advanced stage, these patients have a negative balance of iron, which is produced by reduced intake, an alteration in intestinal absorption, and increase is loss. Particularly, this state of iron deficiency is observed in hemodialysis patients. Therefore, the administration of iron supplements is very important to maintain the requirements in the formation of red blood cells. Video.
Artificial kidney. Hemodialysis. Kidneys are one of the vital organs for the survival. Filtration of urine artificially, other than by kidney, is called hemodialysis. In abnormal or ill health conditions like infections, injury, or restricted blood flow to kidneys will reduce the functions of kidney. This leads to accumulation of poisonous or toxic wastes in the body, sometimes which can even lead to death. In case of kidney failure, an artificial kidney can be used. An artificial kidney is a device which is used to remove nitrogenous waste products from the blood through the process called dialysis. 1. Artificial kidneys contain a number of tubes with a semi-permeable lining suspended in a tank filled with dialysing fluid. 2. This fluid has the same osmotic pressure as blood, except that it is lack of nitrogenous wastes. 3. One line connected to the artery is connected to the one end of dialysis device where the blood is collected from patient for filtration. 4. During this passage, the waste products from the blood pass into dialysing fluid by diffusion. 5. The purified blood is pumped back into the vein of the patient, which is connected to other end of the dialysis device. This is similar to the function of the kidney, but it is different since there is no reabsorption involved. Normally, in a healthy adult, the intake filtrate in the kidneys is about 180 liters a daily. However, the volume actually excreted is only a liter or 2 a day because the remaining filtrate is reabsorbed in the kidney tubules.
Side effects. Oral supplementation is associated with a high rate of gastrointestinal side effects and intestinal malabsorption, problems that are avoided with intravenous administration of iron. Application in nursing. Evidence shows that intravenous iron sucrose is a highly effective treatment for iron deficiency anemia in patients with kidney disease. It is also cost-effective treatment as it reduces the dose requirements of erythropoiesis stimulating agents. Nursing is responsible for the administration of intravenous iron, initial evaluation of our patient, and continuous evaluation of his physical state. Video.
Years ago, Kidney Research UK and a group of UK healthcare professionals began a clinical trial to discover the best amount of iron needed by patients receiving hemodialysis treatment. So how much iron should patients have? Could it be harmful? And how does it affect wider health? In 2013, the pivotal study, as it was called, set out to answer these and many more questions. compared two clinical approaches to giving iron. Patients either received higher doses of iron or lower doses of iron. And now we have the results. We can see that giving higher doses of iron is better for patients than low doses. There were significantly fewer cardiovascular problems and no increased infections with the higher dose. We found we were able to reduce the required dose of erythropoietin or EPO. Doctors do not like using high doses of EPO and prefer giving more iron because other clinical trials have shown higher doses of EPO can be associated with an increased risk of cardiovascular events such as strokes. The pivotal trial provides reassurance that this is a good approach. Also, patients in the higher dose group required fewer blood transfusions. This is really positive news for patients, as this reduces the risk of developing antibodies which can affect a patient having a successful transplant. Anything we can do to improve the lives of patients who have hemodialysis is so exciting. There's still a lot to learn from the pivotal study, as the staff and patients involved have given the researchers so much information. So watch this space for new updates in the future. We are so proud of the 2,141 patients that took part in the pivotal study. They gave their time and medical information so researchers could learn from real patients' real experiences. Thank you to everybody that took part, the patients, Kidney Research UK and their supporters, and all of the 50 hospital trusts that supported us. You've all made a real difference to haemodialysis patients now and in the future. Thank you.
Pros and cons. Pros and cons. It's a way to increase the body iron levels quickly. It is a more immediate treatment than supplements of diuretic chains. Improves energy and easier breathing. Serious side effects. Iron toxicity can cause anaphylactic shock. Conclusion. Anemia is the most frequent complication in the patient with chronic renal failure. Its treatment with erythropoietic stimulants is effective if there are sufficient iron deposits in the body to stimulate erythropoiesis. The administration of intravenous iron allows these levels to be reached safely and with anemia. Discomfort for the patient. Iron gluconate is administered intravenous with satisfactory results. Thank you.